Hello everyone, my name is Ben, and this is my research presentation on risk factors and treatment modalities for ACL injuries. This project was completed with guidance from my mentor, Sally Zayden. Today, I'll walk you through the major contributors to ACL injuries, current treatment options, prevention strategies, and why an integrated understanding of these areas is essential. So, ACL injuries are both common and highly debilitating, especially among young athletes. These injuries often lead to chronic issues like joint instability, reduced sports performance, and even early onset osteoarthritis. So ACL injuries occur due to multiple interacting causes. Intrinsic factors include anatomical structure, hormonal influences, neuromuscular control, and even genetics. Extrinsic factors include footwear, plane surface, and sports-specific movements such as pivoting or cutting. These elements interact most intensely in sports like soccer, basketball, and skiing. Because ACL injuries carry major physical, psychological, and financial burdens, improving prevention, diagnosis, and treatment is extremely important. So even with modern medicine, ACL injury rates remain high. Research is extensive, but most studies examine risk factors, treatments, or prevention programs in isolation. Biomechanically, dynamic knee valgus is a major contributor to non-contact injuries, and structural features like reduced medial tibial depth also play a significant role. There are clear treatment gaps. Surgical reconstruction generally provide better outcomes than rehab alone, and most cost-effectiveness analysis shows surgery is worthwhile for active patients. Prevention programs such as FIFA 11 Plus and PEP are effective, while newer options like KIPP and Hamel knee still need stronger validation. So because these areas are often studied separately, a unified review is needed to show how structural, biomechanical, and clinical factors interact. So this review has three main aims. First, to identify and analyze intrinsic and extrinsic factors that contribute to ACL injuries. Second, to evaluate the comparative effectiveness of surgical versus non-surgical treatment, especially regarding recovery and re-injury. And third, to assess the effectiveness of neuromuscular prevention programs in reducing ACL injury rates. So together, these aims help clarify the full picture of ACL injury management. So to meet these aims, I conducted a structured narrative literature review to synthesize research on ACL risk factors, treatment options, and prevention strategies. I focused on three high-quality primary studies aligned with my main themes and supplemented them with additional peer-reviewed human-based articles. So searches conducted were conducted through PubMed, Google Scholar, Sage Journals, and ScienceDirect using keywords such as ACL injury risk factors, ACL reconstruction versus rehabilitation, neuromuscular prevention, ACL tibial slope, and proprioceptive training. So priority went to studies from the last 10 to 15 years with older foundational papers included when needed. So let's move on to the key findings. So for risk factors, dynamic knee valgus is a major contributor, and structural features like shallow medial tibial depth significantly increase risk, and sex-based anatomical differences also matter. For the treatment evidence, early ACL reconstruction generally produces better function and return to sport outcomes than rehab alone. The Canon trial suggests rehab can work, but its small sample limits confidence. For cost effectiveness, most research show reconstruction is cost effective long term, especially when quality of life is considered. For prevention, programs like Sports Metrics, PEP, and FIFA Plus, 11 Plus reliably reduce injuries. Perturbation-based training further improves stability through long-term data is limited. So the overall takeaway is that effective management requires recognizing risk factors, choosing individualized treatment, and using targeted prevention programs. So in conclusion, ACL injuries are multifactorial, um, shaped by biomechanical, structural, and neuromuscular factors. Dynamic valgus is a major risk factor, particularly for female athletes, and structural features like shallow medial tibial depth further increase risk. And surgical reconstruction generally provides better functional outcomes and return to sport rates than rehabilitation alone, and it is most cost-effective long-term based and it is more cost-effective long-term based on quality-adjusted life years. So neuromuscular prevention programs effectively reduce non-contact ACL injuries and perturbation-based training offers additional improvements in knee stability. So several areas definitely need further research. We need stronger evidence on extrinsic factors such as footwear, plane surface, and sport-specific movement patterns. More long-term data on ACL reconstruction is also needed, especially regarding joint degeneration and psychological recovery. Comparative studies of surgical versus non-surgical surgical care require better standardization and new prevention programs like KIPP and Hamilton should be tested in large populations. Emerging technologies like advanced imaging, motion capture, and wearable sensors may improve injury prediction, but multi-sport long-term studies are essential to determine real-world effectiveness. So this review is supported by 26 peer-reviewed sources. These references cover risk factors, treatment modalities, and prevention strategies, drawing from clinical trials, systematic reviews, and meta-analysis. So all these references were selected based on relevance, quality, and recency, and the full references is available using the link shown on this slide. And thank you for listening.